In these unprecedented times, we need effective immune support. That's why I'm excited to introduce two formulas that work: CV Defense and CV Acute. There's nothing quite like them. CV Defense is a daily preventative. The only supplement that delivers the 6 most important ingredients to optimize your immune function, including PEA, a critical molecule for long-term immunity at the cellular level. CV Acute is a fast-acting, great-tasting syrup for direct immune activation. It eliminates invaders with the fruit, flower, and root of patented Chinese medicine. I take it when I feel run down to fend off respiratory infections. Both products are safe, all natural, and backed by numerous clinical trials. For more information and to order, go to totalimmunehealth.com and take advantage of discounts from 30 to 50% just for listening to Intelligent Medicine. That's totalimmunehealth.com. totalimmunehealth.com for the most exciting immune support products in years. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. It's our weekly rundown of your questions. It's your show. Your participation is essential. Radio program at AOL.com, destination for questions. We've had some great ones in part 1. Let's stay on a roll here with part 2.
This is from Linda. Hi, Dr. Hoffman and Layla. I'm a 39-year-old African-American female and noticed a decline in my white blood cell count over the years. And my 75-year-old mother recently had a routine visit with her primary care, and her white blood cell count was 2.9. Which maybe is borderline. Mm-hmm. She has a history of leukopenia diagnosed by a hematologist she saw as part of her workup prior to total knee replacement surgery. None of the...
So you had a workup.
Yeah, she had a workup, and that's where it was found, the leukopenia.
But it wasn't labeled a disease. Sounds like. So when you go to a hematologist with a low white blood cell count, which is a reason to go to a hematologist, they'll do a bunch of tests to see if you have something going on.
Yeah.
The ultimate test is a bone marrow. And, that's unfortunately a little bit of a painful test. They have to go into the thigh bone, or they sometimes go into the breastbone and the sternum, and they pull out, with a big bore needle. It's not a little tiny needle like you get your COVID vaccination. It's like a drill core,
Pass the morphine.
It's
Thank
you. Yeah, maybe you get a little kind of stuff. But anyway, so they analyze the cells to see if you get a tired bone marrow, they're not producing enough white blood cells, or if you have some abnormalities that suggest you might get, maybe you have a sign that you have multiple myeloma or some pre-leukemia or myelodysplastic disease, which is common, but it may be a precursor to something serious. It's age-related often. Okay.
None of the MDs, Linda says, either of us have seen, have either not acknowledged or at least one stated this is normal for our ethnicity. Are we just being brushed off? Mm-hmm. Is this something that needs to be investigated by a more competent and culturally sensitive provider?
What a great question. And, it's really interesting because there is we talk a lot about, structural racism in various aspects of society.
Yeah.
And, the suspicion is that there is structural racism in medicine, is that they're black, so that's, like they can have a little higher blood pressure, they can have a little higher PSA.
A little higher leukopenia?
A little more lower white blood cell count.
Okay.
It's normal,
Yeah.
And
a little more sickle cell?
Right. It's almost like a form of complacency, like, we have different tolerances for whites. Whites we're more careful. But black people, we can just let it slide because it's, I don't know. They're different. But it is actually true. And I used to reflexly, on my African-American patients, I used to, like a good little, neophyte doctor, I used to send them all for hematology consults.
Yeah.
And I learned early on that the hematologist would send me a polite note saying, well, your patient does have a white blood cell count of 2.7 or 3.1 or 2.9. But there is a racial disparity in white blood cell counts. So the norm is different.
Yeah.
The norm may be different also, interestingly enough, for vitamin D. It's suspected that one of the things that happens with African Americans, I've seen some studies on this, is that they tend to be low in vitamin D because they have dark skin. They don't sometimes.
Yes.
But they also may have some carrier problems with vitamin D, where they may be sufficient in vitamin D, but may reflect a lower level of vitamin D. So the norms may be different racially. I mean, look, let's face it, there are racial differences. We're not going to say there are racial differences in intelligence. There's not racial differences in
of course not.
athletic performance. There's plenty
test.
of white basketball players. White men can jump.
Yeah.
I mean, there are a few, but
kidney function, GFR. Yeah. There's a different category for African American on glomerular filtration. Filtration rate. I can never say that word properly. Glomerular. Yeah, okay. Never mind.
All right. Like, GFR.
But it's different for the African American population, which is very interesting.
Right. Now, is that a reflection of that we have, it's kind of like, do we have lower expectations? It's like, some kind of, allowance that we make. No, it's not. There's different physiologic differences.
I suppose.
So I wouldn't worry about, watch it, because if that goes 2.9 and then it's 2.3 and then it's 1.9, you got to see a hematologist, because, you earned possibly a bone marrow test.
Right.
But if you're hanging out at that level, and here's another analogy that I make is, you may say, well, oh my goodness, my immune system's not good because normal is like 4, 5, 6, and mine's 2.9, so I don't have a good immune system. I analogize that to the Israeli army. It's numerically inferior, but it is tactically and performance-wise equivalent or superior to the overwhelming outnumbered enemies that surround Israel. Mm-hmm. So it's not about it's not about quantity, it's about quality. And having an adequate quality of white blood cells is going to protect you.
Right. Efficient white blood cells.
Right. So I don't make that much of these little glitches. What I have to say though is there's, we talk about races. The races aren't that distinct, especially now. I mean, when, before the era of, colonization and encounter of, Africans and, Native Americans and Asians, there was much less admixture. Mm-hmm. And what we're seeing is that, just do Ancestry.com. A lot of people are going to find that they're part African American, and a lot of African Americans especially African Americans, are going to find that they have a lot of Caucasian or Asian, influence. And so it's a very mixed bag. You can't. So to say African Americans as a whole, what does that mean? It's like a spectrum.
Yes.
Occasionally you'll see somebody directly from an African country where there's no intermarriage, and they are, racially very homogeneous.
Yes.
But more and more, the human race is becoming very heterogeneous.
Yes. True. Linda, thank you for that very, very thoughtful question.
But, I get it. Being in that predicament, it's almost like you're feeling, it's like dismissive. It's, it's a little low. That's okay for you.
Mm-hmm. Oh, you've got that Mediterranean anemia. Mm-hmm. Or...
it's also thought that some of these traits may be an adaptation to...
Yes.
A malaria-infested environment. So, for example, sickle cell is a terrible disease. Mm-hmm. But having two sickle cell genes simultaneously is devastating.
Yeah.
But having a mix of one normal and one sickle protects you from malaria.
Yes.
And it's a positive adaptation.
Yeah. Right. Yeah. That's how they... and didn't cystic fibrosis develop in response to, was it cholera?
No,
or something like that.
Yeah, that's possible. Yeah.
So that's interesting. So
good point at which to pause, because we want to allow one of our sponsors an opportunity to share this vital message with you. So here goes. Naturally occurring black pigments in vegetables, spices, and seeds have been found to have powerful anti-inflammatory effects. Hi, this is Dr. Ronald Hoffman, and I'm excited about what I think may be the next big thing in anti-inflammatory supplements, a brand new, all-natural daily preventative against a host of possible inflammatory issues. Black for Health liquid extract from Future Farm Botanicals. Black for Health combines 4 plant-based foods: black garlic, black radish root, black cumin seed, and black peppercorn, containing high levels of body-ready healing botanicals. Black for Health supports your liver, skin, cholesterol, blood pressure, and weight management, circulation, and immunity. It's a tasty supplement with liposome complex for optimal absorption. For more information, order. Call 888-841-7216, 888-841-7216, or go to myfuturefarm.com/Hoffman. That's myfuture, farm, P-H-A-R-M, myfuturefarm.com/Hoffman, myfuturefarm.com/Hoffman. Thanks for listening, and thanks for supporting our sponsors. They're what make intelligent medicine continuing free resource to you. And now back to our questions.
We've got a question from Anne. Dear Dr. Hoffman, last week you interviewed Dr. Laval on your podcast.
Mm-hmm.
He said that a new study shows that aged garlic extract helps reduce gingivitis at 3.6 grams.
Right.
Or 6 reserve pills.
That's 3,600.
3,600. I went to the Kyolic website, and there it says the dose is 2.4 grams. But I'm sure that's not for gingivitis. So what's the proper dosage?
Well, I think he was citing one study where they went a little higher than the normal dosage.
I'm currently taking 2.4 grams to help reduce coronary plaque. Does this mean that I could kill 2 birds with 1 stone, or do I need to increase the dose to 3.6 for the additional benefit?
I think when you look at studies, you have to sort of extrapolate to real life, and you may get some benefit by taking 2/3 of what the study showed.
Mm-hmm.
It's not ironclad that based on one study, that's what you must take for all forms of periodontal disease.
Yeah.
And, people with periodontal disease have different characteristics. There's going to be some benefit to taking 2,400. But what's interesting is that, both those periodontal disease may contribute to the risk of cardiovascular disease. So maybe one of the ways in which aged garlic extract protects against cardiovascular disease, not a direct effect on the arterial walls, but an indirect effect by suppressing periodontal disease.
Yeah.
And which hence also, when you have bad periodontal disease, you have a high C-reactive protein. High C-reactive protein is a risk factor for cardiovascular disease because it's generalized systemic inflammation.
Yes. Great question, Anne. Thank you for that.
Yeah.
All right. This is from Steve. Hi, Layla and Dr. Hoffman. I take a quality multivitamin that includes all the B vitamins, and most of them are at the RDA, the recommended daily allowance.
Which is paltry.
Yes. I'm wondering...
Well, what is it, for example, what's it for B12?
Oh, I don't even remember.
I think it's like 30.
I
can look that up.
It's been so long since it's been, I look at the RDA and it's like, 3.6 for
That's
vitamin B6.
That's like the kind of stuff you find in a one-a-day multivitamin.
Exactly. Is one-a-day still even out there?
Big time.
I don't even...
the leading multivitamin.
Right. I am wondering if you also recommend...
Centrum, things like that.
I'm also wondering if you also recommend a B-complex and why B-complex vitamins are significantly higher than the RDA. Thanks for all that you do.
Okay, here it is.
Yeah.
B1. 1.1 milligrams.
Oh, yeah.
B2, 1.1 milligrams. B3, 14 milligrams. B5, 5 milligrams.
Yeah.
So much more in a B50, right?
Yeah.
B6, 1.3 milligrams. Biotin, 30 micrograms. People take 5,000 micrograms sometimes for hair, skin, and nails. B12, I wasn't too far off. I said 3. It's 2.4 micrograms.
You're kidding.
Yeah.
Really? It's that low? Okay, yeah. This reminds me of a story. Back in the 1980s, Dr. Hoffman, when I used to carry around in my purse Earl Mindell's Vitamin Bible. Do you remember this book?
Yes.
Well, my grandmother, who was alive at the time, was having trouble with memory and stuff like that, so I got her a B-complex, 25, maybe 50. She took it. Well, she started talking more, and, again, anecdotal, and this went on and it was different. Even her daughters, my mother and my aunts were saying, she's talking more. This is great. So then she goes to the doctor, and the doctor sees what she's taking and says, no, put that aside. I'm going to write you a prescription for B vitamins, which were exactly the RDA levels. Yeah. And can I tell you, she started taking the prescription RDA level vitamins. Yeah. Kind of went back to...
She reverted. So
her tongue was kind of gone.
This is the difference between what is called sufficient to avert vitamin deficiency.
Yes.
Versus
optimal.
Or in the case of people with medical conditions or genetic susceptibilities, to push a little harder against some metabolic choke points.
Yes.
Or metabolic blockades. Mm-hmm. And so that's why someone who has pernicious anemia has to take very high doses of oral B12 and sometimes requires injections of B12.
Yes.
And so, your grandma, we don't know, she might have had pernicious anemia, malabsorption, and she may have required those higher doses to get there. Yeah. Now, a super healthy person in all respects might, get this from the diet.
Right. And not need a super healthy person for something like that. But there are many instances where people would need more B complex.
Look at one gene, just one, and it's one among many, and it gets a lot of publicity, and people, panic when they have an abnormality of this. It's the MTHFR. MTHFR has to do with methylation.
Yes.
But so do several other genes, which are less well known. And those suggest that there may be some weakness in the utilization of certain vitamins to achieve ideal methylation.
Yeah. And
therefore, you need to push a little harder with, say, 5-methylfolate, or occasionally B6, P5P, or methyl B12, the more bioavailable form of B12, or sometimes riboflavin. Mm-hmm. And then people, it might manifest in a high homocysteine, which may require supraphysiologic doses of B12. Yeah. We find this with vitamin D too. So vitamin D, you could say, well, everybody should take 400 IUs of vitamin D, which is whatever now it's like 600.
It's ridiculous.
Right. But we find so many people who have inadequate levels of vitamin D on that. Now, some do okay on that. Yeah. But there's such a variation genetically and circumstantially in how people absorb and utilize it. There's like about, a dozen different places where the vitamin D may be the absorption, the utilization, the receptor effects on cells might be compromised.
Right. And coming back to the B complex, there are many different reasons to take additional B complex. It could be in the setting of stress. It could be in the setting of medication, which causes deficiencies.
Mood effects.
It could be mood effects. It could be something like labyrinthitis, where you need more B6 or
carpal tunnel.
Or carpal tunnel. Thank you. I was going to say
you get a therapeutic effect.
Exactly.
So,
you get it.
So in order to achieve the therapeutic effect, you don't merely fix the. You don't just address deficiency.
Yes.
You're using, in effect, orthomolecular medicine.
Right.
Which is this notion that vitamins at a little higher level that are targeted can have a medicinal effect. And why not? I mean, it's actually been demonstrated that, for certain conditions, vitamins at higher doses than normal can help. Now, does everybody need mega, but no. Maybe not. Maybe not.
Exactly. So, Steve, thank you for that very thoughtful question.
We have time for one more question.
Okay. This is from Sam. I'm a longtime listener. I value your impartial judgment. I get gel injections in my knees, which is really hyaluronic acid. They're very helpful. Hyaluronic acid comes in supplement form. Will the supplement form get to the knee where I need it? Would the supplement be good? What would it be good for if it doesn't help the knees? Taking it orally.
Well, it's a little bit like
good for skin.
Sending an email without the right address. It may not get
knees, please.
Yeah, it's got to go. You're right. It's like, tell it to go to the knees.
Yeah.
It's like, so the local injection is a much more efficient way of delivering it than taking it orally. There may be some benefit to taking it orally. That may be also part of the benefit of glucosamine and chondroitin, which are building blocks for synovial
helps
membrane.
Cartilage, yeah. All right.
So, I think, what's your take on the hyaluronic acid supplements? I think there may be a place for them.
Sure. I think applied topically to skin.
Is that strong. Yeah. There's some skin studies. They're not particularly great studies, in my opinion.
Just hold more moisture. It's innocuous.
Mm-hmm. I don't take them,
I don't either.
And I guess I'm getting a little vain, but I think what do you think, Layla? Impartial opinion.
Well, we're in an office full of plastic surgeons, so it's very easy to get a little curbside consult about something.
I haven't been tempted, but there's an interesting thing going on, which is I talked about it on my radio program. It's called Zoom dysmorphia. Zoom dysmorphia, which is people are on Zoom for hours on end, and whenever you're on Zoom, you see the person who's talking, but you also see yourself.
Oh yeah.
And I am like riveted by how I look. I can't help it. I keep looking at myself like, do I look stupid? don't pick your nose. Don't do anything bad. So I hold my head a little higher because in this angle it makes my nose look, big.
Yeah,
and
my biggest complaint is I hate this fluorescent light on me.
It's horrible lighting.
It's horrible.
The cameras are these inky-dinky cameras. So more and more people are developing this zoom dysmorphia, it comes from the term BDD, body dysmorphic disorder, which young men have often because they want to be more muscular. They want to look like Arnold Schwarzenegger. Hopefully not now the way you look like when he was just 20,
right.
But so more and more. So I talked to the plastic surgeon. I said, "Oh, hey, I see you in the office. How you doing?" I said, "Are you busy?" She goes, "Very busy." I said, "That's great." I said, "What do you think is going on?" She says, "Well, number one, people are looking at in screens all the time, and they're seeing how they look. They're seeing like, I'm getting wrinkled. I need a facelift, or I need a nose job."
Yeah.
It's an ideal time to get that because people are homebound. And they also have more money because they've gotten like the government money.
Yes.
But they also haven't had an opportunity to spend the money. They don't, go out anymore. They don't go to like movies and
so a little facelift
concerts, and they can't travel. That's one of the ways that people spend money. So they have a little extra money, and they figure like, this is a good time. I can't do anything else. So let me work on myself.
Yeah.
So this is a real thing. So can hyaluronic acid help?
Yes.
Bottom line, it may help the skin a little bit, and it may get to the joints a little bit, but the more efficient way. And by the way, the studies on knee injections are very problematic because anytime you have a procedure, there's a very strong placebo effect. So it's very hard to separate the placebo effect, especially with pain, because pain is very subjective.
True.
It'd be one thing if they were going to check a thing in your blood, like your inflammation level or something.
Right.
But it's more like, how does your knee feel? It's like, well, since I got those injections, I feel a lot better. It's like, yeah, but we just gave you like saline with those injections.
Oh, yeah.
Oh,
the placebo effect is absolutely real.
It's very hard to study something like acupuncture or something like that.
Yeah.
But, I think for some people there's an advantage of those treatments.
Yeah.
I mean, if you're like really bone on bone, I'm not sure it's going to help you. But
Right. Sam, thank you for that question.
Yeah. Good questions all around today.
Yes.
And so we invite you to send questions. We've got a couple more in the mailbox, but we're always up for more of your inquiries. Radioprogram@AOL.com is the destination for questions. Anything else, Layla?
That's it.
All right.
Thanks, everybody. Thanks,
That's
Dr.
all she
Hoffman.
wrote. All right. Stay well out there and, enjoy the spring. This is the Intelligent Medicine Podcast.
This is Layla Muden, RD. I see patients regularly, along with Dr. Hoffman. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.